looks like we may be live.
We are live now, Mayor.
Thank you, Susan. Good evening, or I guess good afternoon, and welcome to this afternoon special session of Council for April the 30th, 2020. This is being viewed. This electronic meeting agenda is available on the town's website at greaternapanee.com and is being streamed to the public on the town's YouTube channel. The Municipal Conflict of Interest Act, Council's Rules of Procedure Bylaw, and the Code of Conduct and other pertinent legislation apply to these electronic proceedings as if they were in-person meetings. I'll call for a roll call of the members of council that are in attendance, starting with the Deputy Mayor and going by ward, please.
Deputy Mayor Kaiser is here.
Ward 1, McCormack.
Thank you.
Terry Richardson, Ward 2, present.
Dave Pennell, Ward 3 is here.
Bob,
Norrie, Ward 4 is here.
your screen's frozen. Thank you.
Ward 5, Ellen Johnson, in
Okay.
attendance.
Yep, thank you very much. And could the clerk call for the members of the staff that are present with us today, please?
CAO Ray Callery is with us. We have the general managers, Brant Zatterberg, Rob Searson, Paul Dauber, Peter Dafo. We have manager of facilities, Chris Brown, fleet manager, Bill Hammond, and Charles McDonald, who's the director of operational audits, and myself, town clerk, and Brianna Clement, communications.
Thank you. We will be doing the same as we have before, calling for recorded votes. And if you would just give me your ward, I'll take it that way. We don't need to go into names. If any member of council's connection to this meeting is interrupted, then the mayor will call for a recess of the meeting until the member can reconnect. We either by internet or by telephone. If the member is not able to reconnect within 5 minutes, then the meeting will resume. I apologize to the public that are watching. We have had a few problems getting some of our council members and staff hooked up, but we will now proceed with the meeting. I will call the meeting to order. I need a motion for the adoption, please, of the agenda. Moved by Deputy Mayor Kaiser, seconded by Councillor Richardson. All in favor of that motion, and we will start through with the wards calling out either yes or no.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes, carried unanimously. Thank you. Is there any disclosure of pecuniary interest and the general nature thereof? Seeing none, I need a motion for the adoption of the minutes of the special session of council April the 9th, 2020. Moved by Councillor McCormack, seconded by Deputy Mayor Kaiser. All in favor of that motion, starting with Ward 1, please.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Sorry, Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes, carried unanimously. Deputations, we are fortunate tonight to have with us Dr. Karen Moore, who has been kind enough to take time out of his very busy schedule to come to present information on from the public health, the COVID-19 pandemic update, as well as I'm sure answer any of our questions. Welcome, Dr. Moore. You almost must have this almost down pat that you could do it verbatim, but we're glad to have you come to us, to speak to us, to give us the information that's so important. I will let you take the floor.
Thank you, Mayor. Can you hear me okay?
Yeah, it's low, but it's not bad.
Okay. Well, thank you very much for the opportunity to speak to you and council, and through you to the community. I want to acknowledge that this is a difficult time and many have made sacrifices in our community, and many have fears and worries, and there's a lot of unknowns going forward. I want to be as transparent and accountable to you as possible and share with you the information that I have on hand. Next slide. I'm sorry, I just lost the slides. They were being shown.
Oh, here they come again. Thank you.
Okay, thank you. And next slide. So with your permission, I will just quickly review timelines. And I'm sorry, Mayor, you've seen this twice already. I'll review Kingston, Frontenac, Lennox, and Addington response to date, and we can talk about immunization and potential recovery plan down the road. Next slide. So, I mean, this virus is a new virus. There's a lot of unknowns about it still, but on average, it spreads from person to person. It takes 5 to 7 days for it to spread. It spreads by cough or droplet. When you develop symptoms, you are thought to be infectious a few days beforehand and up to 14 days from the start of your symptoms. So we have the incubation period where the virus could grow inside you, a maximum of 14 days, and then a maximum of 14 days that you are infectious. So 14 is the key number to remember, and that's why we're asking returning travelers to isolate themselves for 14 days so they don't have a risk of spreading it to others, and or if you've been diagnosed with COVID-19, you must stay home for 14 days and isolate yourself, and that's where public health is monitoring those individuals on a daily basis on behalf of the community. Next slide. We are just finishing our first wave. So that peaked on April 1st in KFLNA. There were 11 cases in Lennox and Addington during that first wave. On April 1st, we reached our peak of around 8 cases, and we've had a decrease in cases ever since. And we basically have 1 or 2 every 3 to 4 days. And many of those have contacts to people outside of KFLNA. Whereas that dotted line is where we could have been if the public health measures weren't put in place and the sacrifices that people have made to not go to work, to socially isolate, physically distance, and stay at home if you're sick, etc. So New York City went through this dotted line, and as a result has that serious and significant rise in illness and in death, and has overwhelmed in many places their health system. Certainly Italy has gone through that, Iran has gone through that, Wuhan has gone through that. And because we had the warning, the Premier put the Civil Protection Act in play, schools were closed, businesses were closed, many made significant sacrifices, and we didn't overwhelm the health system locally. And that's only because we've had such a good response for our community. Our community has pitched in, done their part, and reduced the risk of spread. And no one could have done this without the widespread commitment of our community, everyone doing their part. Next slide. So we have worked with many agencies across this region to build that chain of protection to limit the spread of this infection in our community, whether it's your hospital in Lennox and Addington Community General Hospital in Napanee. They've been great partners. They were early assessors of illness in our community, early testers, and hence we were able to detect any returning travelers with illness, limit the spread in our community, and they've done a great job. I can't commend them enough at your local hospital, including Kim Morrison, a local physician leader who stepped up and set up these assessment centers along with her colleagues, nurses and frontline staff. Also, your long-term care facilities have been great partners. Dr. Pierre Robichaud working at John Parrott, they have limited any infections. There's been no infections within their facility, and yet I assure you they've been testing aggressively. And the 4 long-term care facilities within Lennox and Addington have done a brilliant job to date. The retirement homes are being inspected together with the long-term care facilities by public health inspectors and nurses, and they're being advised on infection prevention and control practices. Your primary care partners in Lennox and Addington and the town of Napanee have been great partners. We've also worked at the Quinte Detention Center to improve their infection prevention and control practices, as well as their ability to detect infection in the community. And all of these essential services and partners have been key, including school boards, colleges, and universities. But I do want to say I'm very impressed with Lennox and Addington Community General Hospital, as well as your retirement homes, including John Parrott. They have great physicians, nurses, frontline workers there, and they've been instrumental on reducing the risk of disease in our community. Next slide. As part of our response, we went into an incident management system in late January. We wanted to ensure we had all of our partners lined up in that chain of protection and provided the right information at the right time to them, and have also created an enforcement side with our municipalities and OPP in particular. And we've also had an aggressive communication strategy, and we've tried to be transparent about data as best we can. Next slide. So this is, every day the data changes. So I'm just going to give you an update for KFL&A. We have 61 cases at present, and 56 have resolved. So only 5 individuals in our community who are all at home, and their health is improving. They're being monitored on a daily basis by our public health nurses. Their contacts are being followed up aggressively as well. We have no one in the hospital in KFL&A, either at Kingston Health Sciences and or LACGH Hospital. And I'm knocking on wood, we've had no deaths in our community, and only one outbreak in a long-term care facility of one healthcare worker that was quickly investigated, and there was no local spread. The site at LACGH also continues to provide testing capacity, so drive-through testing through the ambulance bay, as well as an assessment center within the hospital for those that are sicker. And they've separated their emergency department to prevent any co-infection or spread within the hospital, which is a brilliant use of the resources. And they've enhanced their bed capacity and their ability to provide ventilation if required. So I again, can't sing their praises enough. In Hastings, Prince Edward, they've had 41 confirmed cases and just one death. Oh, I'm sorry, four deaths. And they currently have 1 patient in the ICU, and they've had 3 active long-term care outbreaks. And Leeds Grenville, our other sister health unit, they've had 310 cases. So they've had several outbreaks within their long-term care facilities. So 5 outbreaks with a number of deceased. So there were 40 people have died within LGL. But generally, within Southeastern Ontario, our rates are low in the community. When this infection gets into the long-term care facility, so because of the frail nature of the patients in there, it can spread and it can cause death. And hence the need for great, strong partnerships between public health, your hospital at LACGH, and the long-term care facilities to prevent spread and to maximize our infection prevention and control. And I can't say it enough how well your hospital and long-term care facilities have done to prevent spread in those environments. Next slide. If you look at Ontario's trajectory, so that's a blue line, we are starting to level off. So Ontario in general has probably peaked or is peaking now, whereas Kingston, Frontenac, Lennox, and Addington peaked on April 1st, and we've only had a few incident cases ever since. Alberta is starting to level off. Canada in general is starting to level off, but around us are increased cases. So Toronto, Ottawa, and the Toronto region in general remain high-risk areas around us. And certainly New York attack rates are starting to level off finally after significant mortality in their community. Next slide. This is just an indication of our assessment centers and how busy they've been. So these are combined numbers between the Kingston site and the LACGH site I'm very pleased that, on average, we're swabbing anywhere between 50 and 70 patients a day in our community, and assessing them for the risk of COVID. And despite that aggressive testing rate, we are not seeing an increased number of patients with COVID-19. And we're operating a call center here at KFL&A, given that telehealth and other phone lines are pretty well inaccessible given the wait times. We stepped in and have provided over 4,000 direct consultations to the public in our community. Next slide. We've also had great partnerships, as I said, with primary care. We've provided infection prevention and control advice to their clinics. We had an educational session here at the beginning of March where we reviewed the symptoms, the signs of COVID-19, how to test for it, how to refer to the centers. And we got agreement early on that from over 100 primary care providers that they would help us operate these assessment centers and they would help provide increased protection in their practices and continue to provide care to their patients, whether it's through immunization, cancer screening, newborn care, or chronic disease management. So they've been great partners all along, as well as our hospital partners. Next slide. And the acute care capacity, at one point, Kingston Health Sciences Center had over 200 available beds in case we had a surge. They're now down to around 68 available beds with 8 available ventilators. And LACGH has lost some capacity because our hospitals weren't able to transfer back to long-term care facilities over the last 2 weeks or so. And hopefully that bed capacity will be maintained. I think we'll need to maintain a certain number of beds because this virus certainly isn't going away, and we'll need to be able to provide the right care at the right time to the right people within the hospital sector if that's needed. But we'll certainly, as a community, continue to try to do our best to limit the spread. Next slide. I also have to celebrate the work we've done with Lennox and Addington paramedics. They've been, Mark Sheridan has been a great partner. We've now written a medical directive that they can do nasal swabbing for us for the virus. And for those patients that have difficulty accessing the health system, they may be able to go to the home soon and swab on patients that just don't have ability to get to the assessment center at LACGH. So that's now another strong partnership that we should be singing the praises of that team. Next slide. Again, I talked about the long-term care sector. We've been sending inspectors and nurses to these facilities, helping strengthen their infection prevention and control, their outbreak management capacity, and actually doing audits of their practice to ensure they're doing appropriate hand hygiene and appropriate putting on the equipment and taking off of the equipment to minimize risk of spread. Next slide. Yeah, we provided all of those educational opportunities. Next slide. I don't want to take too much of your time. This is the picture of long-term care facilities across Ontario as of the 18th of April, where there's been 367 deaths, 847 staff infected, and 1,533 residents affected. And I'm just so happy and relieved that we haven't had to go through that in our region, with only one healthcare worker affected in our long-term care facilities, 11 of them with over 1,500 individuals at risk. We have had no deaths and only one healthcare worker infected. And that person was detected early, swabbed early, their contacts followed up, and all appropriate measures to safeguard the health of their patients were taken. Next slide. And as I mentioned about Quinte detention, we have around 2,400 individuals in our federal and provincial correctional services here, and we've worked very closely with them to limit spread within their facilities. We're providing direct consultation on outbreak management and infection prevention control. Clearly these aggregate settings, communal settings, are at risk for rapid spread. There's been very high attack rates across Canada within the correctional facilities, especially those in Quebec, with over 40% of inmates infected and a significant proportion of staff. But we've been blessed locally through great partnerships that none of our correctional facilities have been affected. Next slide. And again, for the future, we're looking for either a treatment to reduce the harms associated with this virus and or a vaccine. This is the virus here with the golden spikes are a spike protein. That spike protein is what our body reacts to and creates antibodies against. And it's our belief that if you can clip off these spike proteins and introduce them through an injection into an arm, you can induce immunity in a very simplified form. And that's what's being investigated. But the time it's going to take to make sure that it's safe and effective as a vaccine is probably 12 to 18 months. And then to mass produce it, it could be up to 2 years. Yes, we want a vaccine to give immunity to our community, but it is still a ways away. So we have the upcoming respiratory season where we may have a second, a third wave, but it's our goal together as a community to limit that infection in our community, to detect it early, to identify it through testing at LACGH assessment site, to rapidly isolate individuals, quarantine their contacts. It's worked well in the first wave. We can do it again in the second or the third or the fourth wave if necessary to limit the spread in our community until we get effective treatment and or immunization. Next slide. So you may have seen the framework for reopening our province produced on April 27th. Basically, it takes these 6 criteria developed by the World Health Organization. So transmission must be controlled, and I am confident that we've limited the spread at present within KFLNA. The health system should have sufficient capacity. Well, we have beds available, but we still have limitations on personal protective equipment and testing. We've worked on 3 in vulnerable settings, so long-term care, and for us, our correctional facilities. We can advise workplaces of the important preventive measures that they can put in place. And I believe the government in multiple aspects of multiple ministries are working together to create documents to help safeguard our workforce in various different settings. And imported cases must be managed. So given the incidence rates in the United States, certainly our borders to the United States will have to be closed, and perhaps to international travel as well for quite a long time. And if we're going to open up, we must get feedback from our communities. We must communicate the plan effectively. And we are starting the framework locally based on the provincial framework to identify with our municipal partners what should open up at what phase. Basically, from the health perspective, public health will aid in providing epidemiology and surveillance, be monitoring the health system response, be tracking any spread of infection, and will guide decision makers, our municipal decision makers, if we need to continue to open or to slow down the opening based on any spread in the community. And next slide. So these were the phases for the response plan. Protect and support is the phase that we're at presently. Next slide. And the provincial strategy has 3 stages, and each one of them could be separated by several months, basically to follow any spread in the community as you increase the potential for people to interact. And it has in this plan identified some workplaces, small gatherings. In the second phase, open more outdoor spaces and allow larger gatherings. And the final phase, relax the restrictions of public gatherings and opening all workplaces. No one has a crystal ball to tell us how long this will take. Certainly, if we do see increased activity, we'll have to slow down the stages, and if not, reverse stages if we can't stop the infection from spreading. So it'll be a very fluid state going forward. And you have our commitment from public health to provide you as decision makers with the surveillance data you need to categorize these stages going forward. And next slide. And then recovery phase is probably years away, where we try to get back to the new normal and a new economy and restore the long-term prosperity for the benefit of every individual and family in Ontario, as is listed here. And next slide. Our key responsibility will be to monitor viral spread, monitor the health system capacity, help give you information if we see a rise in illness, and be able to rapidly respond to that, to identify individuals with the illness and quarantine their contacts, and also be able to give you the information you need regarding any resurgence. Next slide. So I have to celebrate the work we've done as a community and you as leaders declaring the state of emergency early on, helping support the measures to stay home, continue the hand hygiene, and practice the safe physical distancing. The work we've done with our hospital and long-term cares and retirement homes, I think has been exceptionally valuable to prevent deaths in our community. And I believe our partnerships with Council have made a difference, but we all need to stay the course. We will have to monitor this very closely and any resurgence in our community. And we'll have to go in a very phased, staged, and evidence-based opening of the economy and be monitoring its effects on a daily, weekly, monthly basis to ensure we maintain the protection of the health of our community. Next slide. And thank you very much again for the opportunity to speak with you. I'm happy to take questions. That's a very quick overview, and I'm happy to open up the discussion.
Thank you, Dr. Moore. Thank you very much. And it isn't a boring thing. I learn something each time that I get to go through this with you. And we all need to know this. I'm glad to see our council have a chance to look at it. Questions or comments to Dr. Moore from council, please. Councillor Richardson, I see your hand.
Thank you, Worship. Up until about an hour and a half ago, I didn't have any questions, but first of all, I'd like to thank Dr. Moore for, I've had the opportunity to read through your some correspondence that you've had with respect to the Cataraqui Conservation Authority. I was able to watch your presentations for the city of Kingston, as well as for the County of Lennox and Addington. I was very impressed with the way that you've able to temper common sense with scientific fact. I think that's very important for us. And I feel, honestly, we're very, very lucky to have someone like you in our community. I just have a quick question. We've got a conversation that's going to come up and near the end of this meeting with respect to boat launches. I see in a report that I received about an hour and a half ago that in keeping with line with other municipalities and recommendations from the KFLA Medical Officer of Health and the MECG recommends that the town of Napanee keep the boat launches closed. Is it possible you could expand on any of that, or if there's any, I don't want you to comment on opening or closing of boat launches, obviously, but just any kind of recommendations with respect to social distancing and if there's any risks to these boat launches, what those risks may be.
Well, thank you very much for your comments and for the question. The use of a boat launch in and of itself is a low risk scenario for viral transmission if it's done properly. If we don't want to bring crowds to one physical location, we want to maintain social and physical distancing, hand washing, hand hygiene, etc. But the closing of the boat launches is more consistent with the provincial recommendations to stay home, practice physical distancing, avoid social gatherings. However, access to someone's residential home, if that's going to be their primary residence, let's say they're a snowbird and they're coming north, if that's the only way to access their home, certainly they should be allowed to use the boat launch. The other point I'd say is opening our boat launches could attract people from afar, which to me, we're in a bit of a bubble locally. We have a low risk of infection. I would be happy if we could somehow limit the boat launches to people from KFL&A because we know we have a low risk of infection. My other concern is this will attract others with higher rates of infection and we'd be left with the consequences of it. So I know that's a bit of a nuanced discussion. For us in KFLNA, I'd be happy if we're the ones that use them, but that's probably not the realistic view. I could see them attracting individuals from afar, and then that being a risk to our community once again. We've done so well so far. I'd hate to see the simple opening of a boat launch to be a source of infection in our community.
Okay, no, thank you. And it's the same as everything else that's going on in the world right now with conflicting information with respect to, there are some that are opened with the inland lakes within the area. So that was great. I appreciate that. Thank you very much.
Okay.
Deputy
Well, thank you
Mayor
for the
Kaiser-
question.
Sorry, and Deputy Mayor Kaiser, did you have your hand up?
I did. Thank you, Your Worship. A comment and a question, if I may. First, I would just like to recognize the dashboard that the KFLNA has on their website. Great little pocket of data for cases, assessment and call centers, charts and numbers. It's a really nice gathering of information that is accessible to anybody. My question then is for Dr. Moore, that maybe you could comment sort of in follow-up to Terry Richardson's question. How close is it? I mean, we're in a bubble, you said. I know Hastings has had similar success, the Hastings Prince Edward Health Unit, but it's not very far away. And I wondered if you'd make a comment about some of the, I know you're in constant contact with neighboring health units, and maybe you could shed a little light on how real the risk is and how close it really is.
So regionally, in the community, I think we're doing very well in Hastings, Prince Edward, KFLA, and Leeds Granville Lanark. In the north part of Leeds Granville Lanark, they do have high transmission, and they've had numerous outbreaks in their long-term care facilities. That could be secondary to their proximity to Ottawa. The rates of disease, though, in Toronto, Peel, York, Durham, Ottawa, are much higher than ours. And we are at risk, given that we are a tourist destination. We attract fishermen, we attract people to our restaurants and hotels, that we will, as a result, if and when the province is opened up, that we will have to be monitoring the health of our community much more closely, given the higher risks of infected individuals coming into our bubble. I do believe the Southeast is doing exceptionally well on physical distancing, social isolation, hand hygiene, getting tested if they develop symptoms. We have done exceptionally well as a community, but we are at risk from everyone around us. And hence my concern of opening the boat launches to everyone else. If we had an internal passport at the boat launch to say, you're from Napanee, you're from Kingston, it's fine, use the boat launch, I'd be happy with that. But we probably aren't going to be able to put in those controls, and individuals from outside will come just because we have the boat launches open, etc. I'd rather see, wait several weeks or a month or so to see that the rates in Toronto, York, and around us go down before we open up our community more to that risk.
And may I follow up on that?
Yes.
So not just for fishing and boat launches, but also coming from other centers and coming to cottage properties or what have you. We're also have the Highway 7 corridor and the Highway 401 corridor going through our region. So that adds to that risk, and that sort of goes with the whole communication strategy around asking people to refrain from visiting their secondary properties as well. Yes?
Yes, Deputy Mayor, that's a very good point. I think our Premier, the Chief Medical Officer of Health of Ontario, have been very consistent with their recommendations of staying home. If it's essential, you visit just, to check to make sure that your cottage is intact, that it survived the winter, check the electricity. Just from an insurance vantage point, we've said, fine, visit, but get your food in the town you're in, bring that food in, and then go right back to your primary residence. We are not encouraging travel within the province or outside of the province at present. We really do still want everyone to hunker down. We'll slowly open the economy, but within a regional basis, not to allow significant travel within the region. That is risky. So our advice is as well, if you have a seasonal cottage here and you're from outside of KFLNA, please visit, bring your food, but go back home.
Thank you.
Any further comments or questions for Dr. Moore? Yeah, Councillor Johnson?
Sorry, Mayor, I had to find my unmute button.
Okay.
Thank you, Dr. Moore, for the really informative presentation. I am wondering if you could speak to us a little bit about the use of masks. Unfortunately, I see a lot of people in the community wearing them improperly, and I have concern that they are going to have a false sense of security by abusing them as opposed to using them. Could you comment on that, please?
Well, I mean, Councillor Johnson, that's a wonderful question, and perhaps I should put something on our website. I know we have some information on masking at present. So if you cannot maintain the physical distancing, so that's 2 meter distancing, so you're on an elevator or you're in a smaller space, those are instances when wearing a mask would be appropriate. But you're right, the mask can give a false sense of security. You may not be putting it on properly or taking it off. So if you're putting on a mask, you should be washing your hands first. You should be tying it behind your ears, putting it over your nose, under your chin, and taking off the mask, because during the time that you wore it, it could be contaminated by someone else. You must be very careful to not reinfect yourself. So you, again, should take it from behind the ears, drop it into your cleaning bag for the washing, and then rewash your hands afterwards every single time. And those procedures of washing the hand before, washing the hands after, and be very careful to not recontaminate yourself taking it off are essential. Right now, I would not wear a mask if I'm out by myself walking at Lemoyne's Point or down the town in Napanee, unless I thought that I couldn't maintain that physical distancing of the 6 feet 2 meters.
Okay. Okay, Councillor Johnson, that's.
Yes, that's excellent. Thank you so much.
Thank you.
Thank you.
Any further comments or questions for Dr. Moore concerning his presentation or whatever else, other questions you might have? Not seeing any hands, I want to thank you, Dr. Moore, for coming to us today.
Mayor? I'm sorry to interrupt, but John was waving. Councillor McCormick.
He's not on my screen, and I guess maybe that's why. Sorry, Councillor McCormack, go ahead there. Now we've got you up there with, yeah. Sorry, John.
Well, thank you, Doctor. 2 quick questions. How are we faring with mental health through this in our area? Have we seen a large increase in depression and whatnot? And my question relates to how long people are going to hold off before they start acting up like they do in some major centers and protesting. And that's part of why we're trying to look at how we could accommodate the fishing locally. And the other one is, I don't know if there's any consideration within the medical field. I suppose there is. If and when a vaccine becomes available, are there any considerations as to how they can make that a mandatory program?
So thank you so much, Councillor McCormack. Those are great questions. So first, on mental health, that's certainly a concern of mine. And I've been on your Municipal Emergency Operations Center with Mayor Warden Isbester, and we've had the input from our local Ontario Provincial Police. They've been telling us that they haven't had a significant increase in calls, but they are starting to see some pattern of increase in calls for domestic concern, potential for domestic violence. So it's certainly a concern of mine that the longer we keep people isolated, that the more stress they will be under. There have been surveys done that have shown that the mental health stress is going up, anxiety is going up. Certainly the concern about employment and income worries me deeply, given the sacrifices that many have made in our community, given that they can't go to work. And hopefully the province and federal government will be getting money into the hands of those individuals that have had to make those sacrifices. We have been monitoring emergency department visits and in real time in Lennox and Addington and at Kingston Health Sciences Center, and looking for any patterns of depression, suicidality. And we haven't seen any people, I think, have been reluctant to use the health system at present. And so we've been advertising helplines and any of the local resources. So anyone listening, I think 211 is the easiest means of getting access to any supports for mental health within our community. They know all of the regional supports, 211, and you can be linked to professional supports in this community. But you're absolutely right. It's a significant concern the longer we're in this, and the need for all of us to balance how we're trying to protect health, but also the social, economic, and mental health aspects of what we're going through. This is new to all of us. And I think we're at a position now in KFLNA, given the low transmission, that we can have a prudent, proportionate, and reasonable response to this. And when the Premier gives us the green light to start to slowly open up our economy, we'll be there with you to give you guidance and to help in a phased and reasonable approach, because we can't keep people locked up much longer without having untoward, unexpected consequences. The other position on COVID-19 when a vaccine, I think that's a brilliant idea, Councillor McCormick, that we advocate for this to be a universal vaccine like influenza, that everyone's offered it. We can provide it in schools through primary care providers, and certainly in high-risk individuals in long-term care. So thank you for that. We will start advocating in advance. Great question.
Anything further from council? No. Again, Dr. Moore, thank you so much. Always informative. You always seem to get some different questions. You probably learned from doing things as well as to the way that municipal governments and upper tier governments work, and the things that we're concerned about, as well as the health, the well-being, and economic well-being of our areas. So I thank you so much.
And I should say publicly that I have nothing against gardens, Mayor Isbester, and we've got the community gardens opened up. The next phase, which will help with mental health and help keep people busy, is maintaining gardens in our communities. I'm right with you on that point, and I'll turn a blind eye if I see a beautiful garden starting to grow anywhere in beautiful town of Napanee.
No, I appreciate that. It's not key. The vegetable gardens are the most important. And thank you for the work that you did to get permission for our community garden, which is on the previous mayor's property. So we really wanted to make sure that we were doing it right. And I think they've got things in the ground already. So if there's nothing further, sorry.
One last point is I've very much personally appreciated your guidance throughout this, Mayor Isbister, and through you, the council. And as warden, I've very much appreciated your guidance, wisdom, and support. It's much appreciated.
I thank you for that comment, because I know that sometimes I just get a little overbearing and a little excited.
Not at all.
Don't be doing that. But it's great to have that sort of relationship with important partners.
Agreed.
I think all of us through FLNA certainly appreciate it. So I thank you for your time. And with that, council, I will entertain a motion to receive Dr. Moore's report. And that was Deputy Mayor Kaiser, seconded by Councillor Pennell. All in favor of that motion? I have to go through the roll call. Sorry. I keep
Ward
forgetting.
1, yes.
Okay.
Ward 2, yes.
Ward 3, yes.
Sorry, Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes, thank you.
Mayor, yes, and thank you very much. Carried unanimously, and try and have a good Thursday night or what's left of it. Thank you very much, Dr. Moore.
Thank you so much for the opportunity.
I'll just get back to my agenda here. I can't imagine how he would think that I would find that boring, because we've never had the same questions from council, and it's always new and informative piece of information. So items for discussion, 6.1, Solicitor General correspondence. We did put a request in asking about the deferral of one of our largest expenses, the OPP. You council has it within the agenda and within their hands, plus the information on the community safety and well-being, planned deadline extension, which of course we can't work on right now because it's too large a group to try and get together and keep going. So that has been extended as well. So you do have a recommendation, although certainly if you want to chat about it, that's fine. But the council received for information the two pieces of correspondence from the Solicitor General. Does someone wish to move that? Deputy Mayor Kaiser, seconded by Councillor McCormack. Are there any comments or questions, Deputy Mayor Kaiser? And then we'll go to Councillor Pennell.
My only concern about the deferral of a payment is that it may be that I just hope that the province is a little bit kind when it comes to catching up. I forget what I was reading yesterday, something about a deferral, but if you took the deferral, it was all due in September. And I thought, well, that's not very kind in the end. It may be in the temporary, but later on you really get slammed. So I'm not saying we shouldn't pursue a deferral, but I just hope that we are talking to the province and talking to Mr. Cramp, our local MP, that any deferral does not result in a unreasonable catch up in the end.
Certainly agree. Councillor Pennell.
Thank you, Madam Mayor. I just have a question in regards to the letter dated April 24th and to defer the OPP payment. I noticed that this is a monthly payment. So is our monthly payment due tomorrow? And what happens if we don't hear back from the Solicitor General in time? What happens if we don't make this payment?
I'll call on our GM of Finance to answer that question because we have been making the payments.
That's correct. Thank you, Madam Mayor. We have been making the payments. We are current. I know that one of the consequences of not paying it would be a considerably high interest rate. Beyond that, outside of financial, I'm not sure of the consequences. As far as our cash flows go, we are able to make that payment at this point.
Councillor Pennell.
Thank you for that, Paul. Just typically dealing with Solicitor General, are we looking at hearing something? Do you think we'd hear back something in May, or is it typically a long-term wait for something like this to come back at?
I'll defer to Paul and Ray here. I think that, if I'm not mistaken, that letter went off to SolGen. I'm going to say 1st of April, or even before then, Mr. Cowrie.
Yeah, yes, it did, Madam Mayor. They've had a request from us for probably 6 weeks. The initial request, then we've set a subsequent one that had actually a few other municipalities support us in a joint letter asking for that deferral as well. Currently, the billing system is actually down at the province, so they haven't billed us. We've paid everything that they've billed us for, but I understand there's a delay in their billing platform right now, so we may get a little delay unintentionally, but certainly we haven't heard back yet. The MPP's office is reviewing it. AMO's aware of our concerns, and we're still trying to establish both through the Ontario Provincial Police and through the Solicitor General's office. That's the first response back from the Solicitor General. We've had 2 or 3 updates from the OPP that they're following up from their end as well on this issue.
Thanks very much, Mr. Cowrie. Any further questions or comments?
I was just going to say thanks, Ray, on that.
Okay. Any further comments or questions regarding this? If not, you have a recommendation before you, just to keep going forward with this and receive. Moved by Councillor Richardson, seconded by Councillor Pennell. All in favor of that motion with the roll call, or opposed, one or the other?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes, carried unanimously. Maybe the system won't get up again and they'll never send us another bill. I'm not thinking that will happen for sure. 6.2, flood mitigation pilot project update. Do you have a staff recommendation that we receive for information, the CAO flood mitigation pilot project update report? Yeah, moved by Deputy Mayor Kaiser, seconded by Councillor Richardson. Comments or questions? All in favor of that motion? Ward 1?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
And Mayor, yes, carried unanimously. Okay, 6.3, CAO, a report that we asked for on short-term accommodation update. We have a recommendation that council receive for information, the short-term update. Did council wish to speak to this first? Councillor McCormack?
I'd just like to comment, Your Worship, that we've seen in surrounding areas nightmare stories of neighborhoods that have been overtaken by Airbnb. So I understand that, you know, and I hear stuff in the media where people are questioning why we're looking into this. Really, it's to be proactive and be ahead of the curve. So I don't think we need to spend a ton of money on this right now, and we're going to work with what staff has available to put into it. But I also understand that there might be some funding available to help us get through this. And I think we still have to stay on top of this, is my opinion, not to wait until we have an issue like they've seen in Prince Edward County, and then it's kind of too late. So that's my 2 cents.
Anyone else wish to speak to this? Councillor Johnson, and then did I see your hand, Councillor Pennell, after that? Okay, Councillor Johnson first, please.
Thank you, Mayor. I don't think this is something we can afford to work on at this point in time. It needs to be a very well thought out policy. It will definitely have long-ranging impact on tourism in the area. And although there won't be very much this year, hopefully next year it will be back again. We also have people who are using Airbnbs for professional stays for a little bit longer period, who don't want to stay in a hotel, and it's unfair to paint all Airbnbs with a negative brush. There is certainly a lot of good business models for them operating within communities as well. I just don't think this is the time for us to look at it. That's it.
Councillor Pennell?
Thank you, Madam Mayor. I have to agree that this is a very important topic, but I'd have to say that it's maybe at the wrong time with the pandemic that we have right now. I think that our efforts could be used more wisely. You know, maybe trying to get these boat ramps open or something along those lines. And of course, we want to keep the curve down as what we just heard through the presentation. It's a tough one because, you know, what are we going to do about these? How are we going to stop them? You know, somebody buying a piece of property and then renting it out. You know, it started years ago by just somebody renting out a cottage for the weekend. I don't think that this is something that we can take lightly. I don't think that it's going to be a short, easy answer. I agree I'd like to stay on top of it, but I really don't think that we have the effort that this deserves at this time. And for that, I would like to maybe make a motion to table it for a while.
Okay, I believe that Deputy Mayor Kaiser wanted to speak to it. Councillor Richardson, did you have your hand up? No, I've got Deputy Mayor Kaiser was first and then I'll come to you.
Thank you, Your Worship. I could be wrong. I'm not standing in the town offices to see who's doing what on any given day. And I know that this COVID-19 has changed our operations dynamics, but I gotta believe that there's some opportunity for some background work to be begun and some legwork to be done in-house, as Councillor McCormack indicated, that we can use our internal resources and our internal knowledge and such. There's also neighboring communities bylaws and the backgrounds on those that we could probably gather reasonably without any heroic effort, because whether we start to begin a new normal that allows for this sort of activity in 2021 or thereafter, I don't want to be starting this when we start our new normal. I think we should be preparing ourselves for the new normal now, so that when it arrives, we're already ready. And so that for that reason, I think we should go ahead or ask staff when possible, when it's reasonable, as long as it doesn't take a heroic effort. If it's something that can fit within somebody's portfolio at this time, then I think we should be pursuing this.
Okay, thank you. Councillor Richardson?
I'd like to thank the deputy because he took a lot of the words out of my mouth. So, but I have to agree. I think it's something that we should be looking at sooner than later. We don't need to, I don't think we need to go out and spend a whole pile of money and get recommendations. But as the deputy said, I know that probably our neighbors across the bay had wished that they had gotten involved in it sooner than they did, because at least from the indication I'm getting and hearing and seeing, and I don't mean to trash Airbnbs, I just think they need to be regulated, that's all. So, I mean, they may be an important part of our tourism. However, I think we have to put some kind of regulations in. So, I mean, I have to agree with what the deputy said, is that maybe it's something that we can start looking at and start to move forward sooner than later.
Any further comments or questions? I would have to agree that certainly we don't need to bring in any consultants or anything on this. There's a lot of information just with our neighbors that have seen this. I guess my recommendation would be, I think that sooner than later is the better idea. We are going through an official plan update, perhaps review, and it does expire in 2022. So to me, I think it's very proactive, but it would have to be a timeline. So I guess my suggestion would be, although I think that Councillor Pennell had a motion that he wanted to put forward, which will allow him to put the motion forward to get a seconder, and we can discuss it that way. Councillor Pennell, did you still wish to put a motion forward?
Thank you. Yes, I do. I would like to put a motion on that we table this until we see what's going on with this COVID and look at it again. I'm not sure what kind of a time frame that we need to put on there, but I would like to just allow staff to continue on and work and get us out of the bind that we're in right now.
Is there a seconder for that motion? Councillor Johnson has seconded the motion. Deputy Mayor Kaiser, did you wish to speak to it again?
Yeah, on the idea of tabling it, perhaps it's appropriate then, if we're going to table it, because the timeline that Councillor Pennell suggested is very vague and open. Maybe we could seek staff guidance on what is possible, what could be done in-house, and what is reasonable for our staff to undertake at this time or in the coming weeks or months, so that it's not just left hanging. But like I said, we may not have firsthand knowledge of what's possible and what the capacity is to do this, or what it may be a month from now or 2 months from now. And maybe through the CAO, when it seems to fit better, that it come back to us at that time. Is that fair? Is that reasonable?
Mover and seconder, are you looking for a friendly amendment then, Deputy Mayor Kaiser, to defer it? No,
I guess I'm just offering that the timeline be tightened to the extent that it fits within staff capacity, and that we seek guidance from our senior staff for when that might be. And maybe that's how we draft the motion to table, that it fits reasonably.
Okay, Councillor Pennell.
I would gladly accept that friendly amendment and the help of Deputy Mayor on his wording on that. Thank you.
Seconder.
I would agree with that as well.
Susan, before we vote on this, do you have the information? Do you know what the motion is that council is willing to put forward?
Yes, I'm good. Thank you.
Thank you. So if there's no further comment, yeah, sorry, Councillor McCormack.
Could I hear the motions the way it stands at the moment?
No. Susan, could you please read the motion for council?
Council receive for information the short-term accommodation update report and table it until a timeline that fits within staff's capacity at senior management recommendation.
Mover and seconder, satisfactory? Okay, everybody's good with that? Thanks, Susan. I'll call the question. Councillor Norrie, you have your hand up?
Just turning my mic on, sorry.
All right, thank you. That's okay. I'll call the question, starting off with Ward 1, please.
Ward 1, no.
Ward 2, no.
Ward 3, yes.
Ward 4, no.
Ward 5, yes.
Ward 6. Deputy Mayor, yes.
Mayor Isbester, no. So the motion is lost. So, council, where do you wish to take this? The motion was lost. Do I have a further motion? Councillor Richardson?
Rather than tabling it, why can't we just ask if our senior staff, if we can put this over, if they can, at least to the next meeting, to give us an idea as to how much work is going to go into it. And then we'd have a better idea as to whether or not we should be moving ahead with it. Like I say, I like the idea of maybe just making some phone calls or checking with our neighbors to see if any of their policies might sort of fit, and then we can tweak them, or if we've got to go full bore and send it out to somebody else. But I have to think that geography wise, we're very similar to Prince Edward County. So I would think that a lot of the same policies may interact or work. So maybe we can just put it over for a bit and get an idea how long it'll take to do.
Okay, Councillor Pennell?
Madam Mayor, just in response to Councillor Richardson's comment on there, that's definitely a definition of tabling it, holding it over, even if it is for the next meeting.
Council's wishes. Come on, let's go. So are you making that by way of, are you putting a timeline on it? Councillor Richardson, do you want to make a motion so that I can put something down in the books, and so can the clerk, please? Sorry, you're muted. You're muted, Terry. Thank you.
Sorry, Your Worship. I will make a motion if you wish that we bring it back to our next meeting. That will give senior staff an opportunity to give us any kind of an idea rather than tabling it, because the rules for tabling things and untabling things are far greater than putting it over to the next meeting.
So you're moving that we get a report at the next meeting as to what the possibilities are for looking into this, if it's just even going to our neighbors. And I know that Susan can wordsmith that, but to bring back information so that we can make a more defined decision. Would that be?
Sorry, Your Worship. Yes,
okay.
That would be it.
Okay. Moved by Councillor Richardson, seconded by Councillor McCormack. Any further comments or questions? Councillor Johnson?
Thank you. I agree with some of the comments that have been made. I don't feel like we need to pull a consultant in on this project, and I would like to see it be part of a larger plan. I would also like to see some form of discussion with members of the community so people have an opportunity to voice the pros and cons as they see it before we make a final ruling on this. So I think this allows all of those things to happen, and I'm happy with that. Thank you.
Councillor Johnson is an excellent suggestion, and perhaps a friendly amendment would be to make sure that before we do anything on this, that we do have public consultation, even if it's a chance for people. I know that I got several emails on it, just it being within the thing. So would the mover and seconder look perhaps at adding that to it, that there should be public consultation by people that would be affected by it? Councillor McCormack is, I believe, saying yes. Councillor Richardson. So added to that would be public consultation. Okay. Deputy Mayor Kaiser, were you wanting to speak?
Just, whether it was by way of a friendly amendment or not, I think the intention is, and I think senior staff are listening to hear that what we're really seeking is a knowledge and understanding of what capacity we have internally to do it and what process they might recommend in order to do it internally. And absolutely, Councillor Johnson, public input from our residents, pros and cons, is an absolute must. But anyways, I think senior staff are hearing that, and that's what we'll hear at the next meeting.
So everyone happy with that? Susan, oh, sorry, Councillor Pennell?
Thank you, Mayor. I just wanted to read in the report, the reason why I came up with what I did and the reason why I wanted it was the second last paragraph in the report was, with the COVID-19 pandemic, large public engagement is not impossible, but it's difficult during this time. Staff resources are being stretched. Other major projects, including potential flooding concerns and reestablishment and alteration of public services, are also requiring staff resources.
Yep.
So I think that we're just adding to their list.
Yep. No, and certainly point taken. We have to remember too that this did come before council, I'm going to say back in October or November of last year, and it just kind of, when we got into budget and so on. So it's not the first go round.
Yeah,
I don't think any of us are looking for an immediate answer, but I think it needs to stay on our radar as unfinished business so that we can make sure that if we're going into any kind of consultations, any kind of public meetings, when we're allowed to do that, please God, let it be soon. And that we can then be prepared for it with at least some background. I don't think anybody is looking to bring a consultant in on this and spend millions of dollars, which we don't have. If there's no further comment, I'm going to call the question. Ward 1.
Ward 1, yes.
Ward 2, yes.
Ward 3, no.
Ward 4, yes.
Ward 5, yes, I'm happy with the changes.
Deputy Mayor, yes.
Mayor, yes. Carried. Thank you. Infrastructure Services Planning, 449 Milligan Lane Zoning Bylaw Amendment, PLZ ACO 2019-054. You have a recommendation the council receive for information the planning report from IBI Group dated April 2020 regarding 449 Milligan Lane Zoning Bylaw Amendment, ZACO 2019-054, and that further that council approved the zoning bylaw amendment subject to the following condition: that council consider and decide on the merits of written and verbal submissions received up to and including the council meeting, that should new information be received or further input received, raise points for further consideration, this report and opinion herein be revisited. Michael, are you in the meeting with us?
Yes, I'm here, Your Worship.
Yeah, anyone, Michael, do you wish to speak to this, or would anyone like to, does anyone have questions of Michael that they would like to have before we look at what the recommendation is?
Just to clarify, there were no further written comments or verbal comments or inquiries made to staff.
Okay, thank you. Yeah, Deputy Mayor Kaiser.
I just want to draw attention to the fact that in this report there's a couple mentions of sensitive land uses and specifically being daycare facilities, and point out that in this situation where we have this light industrial park, it's unfortunate that at some point in time, previous councils have given permission to those sensitive uses to exist within an area that they weren't appropriate, not the other way around. And so now it's actually positioning them in such a way that it's limiting appropriate uses within the area. And in this case, I don't think it is, but it potentially could have. And I just wanted to say that out loud, that hopefully as time goes by, if they move on, we should be considering what's the most appropriate use and not the fact that, anyways, I guess I've said enough. Now I'm going around.
Okay. Any further comments or questions from council? If not, you have a recommendation before you. Moved by Deputy Mayor Kaiser, seconded by Councillor Norrie. No further comments or questions? I will call the question. Ward 1.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Thank you. Infrastructure Services Planning, Richmond Park Drive, North Development, Part Lot 18, Concession 2, former Township of Richmond, Official Plan Amendment PLOPNA 2019-002. Michael, did you wish to speak to this, point out anything, answer questions of council before we decide on what we're going to recommend?
Yes, Your Worship. If I can just take a few minutes, I'll just run through at a high level what the proposal is. I'll keep my my camera off just because my internet's a little bit choppy right now, so hopefully that'll help. So this application proposes to redesignate lands north of Canvers Way into low, medium, and high density residential out of its current fringe area designation in the official plan. Originally, the application proposed to designate the entire 53 acres of the property for such uses. However, after careful review and consideration of future transportation layout needs for the greater fringe area itself, staff recommended to the applicant to pull back on the amount of land that they wanted to have redesignated. And that was to preserve future east-west transportation corridors through the lands in order not to prejudice the build out of the lands east and west of this site. So this resulted in a reduction to approximately 23 acres of land in the southern portion of the site proposed to be redesignated, and the remainder to be left in the fringe designation. During review, we had meetings with LNA County transportation staff and our transportation engineer, really talking about what that future road network in the area was going to look like. And ultimately, the recommendation from the county and our transportation engineer was that the town should conduct a municipal class EA to determine what that exact road network and servicing capacity would be for that broader fringe area. So really, in considering proposals for applications within the fringe area, generally a large-scale secondary plan exercise would be completed by the municipality, so municipal-led. And that would be to designate future land uses, identify future road corridors and servicing, et cetera, for the broader fringe area itself, not just a smaller portion. But in this instance, the proposal is to designate lands at a very limited scale in the southern third of the site. And a large east-west road right-of-way is proposed to provide for future connections east and west through the property to the adjacent lands. So the proposed placement of this east-west corridor is also logical since there is a very large wetland in the middle portion of the site that any future road would have to navigate around. So where that road right-of-way is proposed now really makes logical sense. Also, a large component of the review was to do with access via Richmond Park Drive, its impacts on the transportation system, the development's impacts on water and sanitary systems, archaeological considerations, emergency access, stormwater management, and environmental impacts. Staff didn't want to prematurely recommend designating these lands if they could not adequately be serviced and meet planning principles. However, when we finalized our review, the proposal was deemed to satisfy all these requirements at this stage in the approval process. So this application, if approved by council, would be followed by a draft plan of subdivision and zoning amendment application to identify the finer details about the built form of the proposal. And this proposal specifically is to identify what those future land uses would look like, specifically being a high, medium, and a low density designation to permit apartment buildings, townhouses, semi-detached, and single detached dwellings. It's also important to note too that we've written in a provision to require a minimum of 800 square meters to a maximum of 1,500 square meters of commercial ground floor provided in one of the apartments to service that localized residential area there.
Michael, are you done or did we lose you?
No, that's it, right?
Sorry, I just you went off on such a note. I wasn't just sure that that you hadn't disappeared on us with weak internet. Councillor Pennell, I see you have your hand up for a question.
Yeah, through you, Mayor, to Michael. Michael, thank you very much for that. So I have had a couple of residents contact me with the concerns that land that is proposed for development is actually zoned prime agriculture. And I'd like to just have you reconfirm to everybody that's listening, not only here, but at home, that it is fringe and that it is the designated D for development on that. Could you, and then I have another thing for you after that.
Yes, that is correct. It's zoned today for future development. It is not zoned prime agriculture, and it is designated in the official plan as fringe.
Fantastic. Thank you very much. My only other comment was, and we've had some communication going back and forth on this, is that I'm not completely satisfied with the traffic study, and nor am I ever going to pretend that I can fully read it to its capacity. But I would like for us to somehow, when this development starts and the other developments that are around, is capture some funds so that we can put in some traffic lights at the corner of Richmond Park Drive and Bridge Street. Since the removal of the stop sign at County Road 1 or Belleville Road, it's 9 blocks before the traffic stops again. And although I could probably agree with you that the road can handle the capacity of the vehicles, it's just that there needs to be a break for the residents that live in that ward. It's very difficult to get in and out of driveways at time. And we saw a live example of this when the Dundas Street renovations where the construction was being done in 2019. So I just want to throw that out there and see if there's something that we can do for there, because with the added, not only with this project, but with the other projects that are up there, that's is going to add some more residential. There's going to be more cars on the roads. Thank you.
Yes, absolutely. If during review of the draft plan of subdivision application, council deems it necessary that they do want to see an installation of streetlights at that intersection at some point, we could make it a condition of draft approval that the developer provide some amount of funds to go towards that future installation. That could also be imposed on lands east and west of the current site. So when and if any landowners east or west of this site come in for an application such as this, we could also impose that requirement on those individuals as well.
Great, thank you, fantastic.
Deputy Mayor Kaiser.
Yes, please, thank you. Yeah, I was gonna jump on that too with the traffic lights. I certainly think it's appropriate, and I think we need to press that issue a bit, and whether our development fees in that instance can go towards that, or I hadn't considered other future development up and down the sort of west fringe of the town that maybe it should all be attributed to that future use or future need, and future being pretty darn soon, as soon as we put any more load in that area, that we should have traffic lights. I also wondered if, and so I'm asking Michael about development fees. Are those fees eligible to be used for road network planning? Is that an appropriate use of those sorts of fees? And I'm wondering where that fits in as far as planning that we would have to do in the near future. And then I have one more after that.
Excuse me. Yes, the development charges that are collected are allocated to certain different funds, and one of those would be performance of studies that are directly related to growth within the town. So, for example, our official plan amendment could be funded from development charges, and you know, a road network study could also be funded from such fund as well.
Thank you. And my last thing was reading through the report. In this proposed development, there's talk about the units per hectare and what classifies as low, medium, and high density. And I found it interesting that the medium density meets the low density requirement and the high density meets the medium density requirement, but they're still classified low, medium, and high despite that. Is that concerning? Is that anything we need to consider just based on the numbers? I'm just curious about that. I guess that was a question for Michael. I don't know where he went. So I'll just reiterate that the medium density actually is below the 30 units per hectare requirement of low, and the high density is below the 60 units per hectare density of medium, but they high. I think that's good, but it also draws attention to the fact that despite their definitions, it's actually lower than their classifications criteria.
Sorry, I just lost my internet there. I'm back now. I lost you right at the start of your question after.
I guess it was mostly just a comment. The low, medium, and high density criteria, their definitions are all below the criteria maximums, but they've just decided to define them that way. Is that appropriate?
Sorry, if I could just paraphrase, I did lose you there a little bit, but I think what you're asking is, with what is proposed in front of us today to be redesignated, does that fit within our official plan policies for density, so number of units per net hectare?
You're muted, Max.
Sorry, I was saying that the high density is actually below the medium density threshold or limit, but they've classified it that way. Is that appropriate?
It is. Yeah. So at this time, they're only contemplating a certain number of units over that larger area. However, with them designating it for higher density uses, they could go upwards from where they're proposing the number of units today.
Okay. Councillor Johnson, you had your hand up.
Yes, thank you, Mayor. First, I wanted to thank Michael for answering the questions that I sent by email and for clarifying a couple of points. And as always, he just shared that information with everyone. And I wanted to thank you and your staff for working with the developers to come up with a plan that is much more palatable to the long-term planning for our community. And the only other point I wanted to make is that this is now the second, or will be third, subdivision in this. We're not even halfway through the year yet, and it just underlines the importance of the work we need to do on our wastewater treatment center. And we can't lose sight of that either. So thank you very much, everybody, for all your work.
Any further comments or questions of Michael? If not, you have a recommendation before you, Council. Moved by Councillor Pennell, seconded by Councillor Richardson. Any no further comments or questions? Okay, so off we go to the roll call, please.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes, carried unanimously. Okay, infrastructure services, parks and facilities, grass cutting operations. I know that we have Chris online with us. Chris, did you wish to speak to this or stand ready for questions from council? Are there things you wanted to bring to our attention before council started to discuss it?
No, I'd be happy, Your Worship, to answer any questions if you guys have any.
Okay. Council, questions of Chris? I think it's pretty straightforward. The government is saying that we're allowed to do this. It's dry, there's ticks, there's all kinds of things that we need to be out for. So you have a recommendation to receive for information, the grass cutting operations report. Moved by Councillor McCormack, seconded by Councillor Johnson. I will call the question. Ward 1.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes, unanimously, and thank you very much, Chris. Hopefully it won't snow before we get cutting. Light fleet purchases under state of emergency. I know that there's been lots of information that council has been asking Mr. Hammond. You do have a recommendation there. Welcome, Deputy Chief. Are there questions or comments that you'd like to go over with the Deputy Chief before we start deciding what to vote on here? Councillor Pennell first, please.
Through you, Mayor, thank you. Deputy Chief, could you just clarify again for the people that are listening and the people that may have read your report, thank you very much, and notice that the half-ton truck, pickup truck that you've selected to award the tender to is actually more than the other. And I know you answered this question for me, and I was very satisfied with your answer. But could you just explain that to the general public, please?
Absolutely, through the chair. What we did was we went out for quote on 3 primary vehicles that we need to continue with staff services and the level of service to provide the community. What we did was we solicited the 2 local businesses in town that provide new vehicles. I then, going through the 2 quotes per half-ton and 3/4-ton vehicles, looked at the old RFT to ensure that the vehicles were similar in nature. And from there, I made the decision to go with the half-ton truck, which was a little bit more expensive because it came in with all of the options that the original RFT took into consideration. And then looking at the vehicle that was a little bit less of a cost, we would have had to make some options or added some options to it, which would have driven it over the cost of the second quote. So I decided at that point it was more palatable for me to put that into the report and then and bring it back to you for a vote here.
Thank you very much. I appreciate that.
Any further questions or comments from council to Deputy Chief Hammond? Or Bill, did you wish to say anything else?
Just for those that are out there watching and looking at all the other comments that are online, we don't take these measures lightly. We wanted to make sure that we carried on with business. If we push vehicles this year, it is going to cost us more next year, and we don't know what the underlying cost of vehicles will be as we come out the other side. So we're trying to be frugal with our dollars, and I hope as we move forward through this, the other vehicles may come online at some point as well. And we do have a snowplow that I haven't brought to council yet as well, and I'll have a report hopefully in the next go around here.
Good, thanks very much, Deputy Chief. That was actually my question. I know that we have a plow that we need to be replacing. The repairs on it have been very expensive. Am I mistaken that it's 2008 that the plow that's still working? Am I even close on that?
You are accurate, yes.
Thank you. Well, if council has no further comments or questions to the Deputy Chief, you do have a recommendation before you. Moved by Councillor McCormack, seconded by Deputy Mayor Kaiser. No further comments or questions. I will call the question and the roll call, please.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes. And I just wanted to commend the chief on tracking the RFP in order to get what he needed locally and also to support some of our local businesses, because that is going to make a huge difference as to who comes out of the other end of COVID. Thank you.
Excellent point. We all appreciate that.
Deputy
So-
Mayor, yes.
Okay, and the mayor, yes. So carried unanimously. Thank you very much. Okay, infrastructure services, waste disposal sites reopening, update, related correspondence from residents. You have a recommendation that council receive for information. Infrastructure services, waste disposal sites reopening update report and the related correspondence received from residents. And further, that waste disposal operations resume May the 2nd, 2020, as per council resolution number 225/20 for Roblin and amended at South Fredericksburg to allow 2 vehicles per waste stream on site at one time to a total max of 6. And further, that council approved the increase in salary expenditures to facilitate a 6 vehicle maximum at South Fredericksburg. And further, that council provides staff with the additional service level expectations for staff to prepare financial estimates for waste operations that would be compliant with provincial COVID-19 orders, as well as site-specific environmental compliance approvals. And further, and I'm reading this because not everybody has an agenda in front of them while they're watching this. And further, that staff bring a comprehensive report to council for all waste disposal operations that will identify at a minimum current operations, opportunities for improvement, risk mitigation strategies, public education initiatives, financial implications, potential revenue, and environmental compliance. Then you have the letters that we received as well. Council's wishes. Yeah, Deputy Mayor Kaiser.
Thank you, Your Worship. Well, at the end of this, I'll make the motion, but I really appreciate our senior staff and our emergency management group for working on this and evolving the situation. Week 1 had some issues. Week 2 was an absolute strict following of the protocol. This is a further evolution to see if we can't make it a more fluid situation and a little bit easier. But I would like to point out that Loyalist dump operations have a very strict maximum and they follow it too. This actually will set a much higher bar, and it will cost us. It will cost us a little bit more in staffing to make that happen, but the staff believe this is a reasonable and doable approach to making a higher flow rate through the South Fred dump. And I appreciate their guidance on this. I myself wasn't able to attend the dump site either weekend as I was in the field both times. But I'm pleased to see that the evolution is continuing and that we're trying to make it better for everybody. And I just want to say, from the perspective of the emergency management group, the messaging has been clear and straightforward right from the start. Stay safe, stay home, minimize non-essential travel. This largely flies in the face of that, and we need to keep cognizant of that fact. But having said that, if we can do this and do this safely, and the staff believe they can, then I can support this. So I'll make a motion for staff recommendation.
So that was moved by Deputy Mayor Kaiser. Do I have a seconder? Yeah, Councillor Richardson. Further comment? Councillor Pennell, and then I've got Councillor Johnson, and then Councillor Richardson. I'll come to you. Councillor Pennell.
Thank you, Mayor. I just have some couple of statements, and then I do have a couple questions for Mr. Dayfill on this. In those letters that we received and from other communications that I've received, I'd just like to remind everybody that's listening tonight that when we voted on this to open up the dumps, right from the get-go, it was always 2 cars. Whatever happened at the Self-Red dump on the first day is over with. I'm gonna just talk about that for a little second, but it was always 2 cars. So when the second week came along and it was a longer wait times, that was just because they were trying to put it back to 2 cars. So with a question to Mr. Defoe, in the report, it says that in report states that there was long wait times at the Self-Red, and the decision was made to allow 10 cars in at one time. Which weekend was that for? Was that for the first weekend or the second weekend?
Through your worship, that was for the April 18th.
Okay, thank you. And my next question, just because it goes on, it says, it also states in the report that if any alterations for the opening hours, these changes must be approved by the ministry. Was the extension in the weekend 2 hours to 5 p.m. on April 25th, was that approved by the ministry?
Through your worship, we didn't apply for that.
Okay, thank you. And the last thing I'd just like to say, tonight we're given 2 options to vote on, and both which will come to a cost to the taxpayers and the taxpayers that are not using the dump to drop off yard waste. If someone feels that it's essential for them to drop off yard waste at the dump and go against the essential travel, then they should be prepared to stay in line. I know that Mr. Kaiser is going to make a motion, but I think with reading the report, if this is going to go forward, instead of adding the 2 personnel to the Self-Red, I would rather see 1 personnel be removed from the Roblin dump to go to Self-Red and not have anybody else there. So just the addition, just move the 1 person over.
Can you speak to that, please, to make sure we're all clear on what we're doing with staff, please?
Through your worship, the question of staffing. So the two vehicle per waste stream is based on staffing and social distancing, and our ability to provide very diligent oversight on the environmental compliance. So we could, because the numbers in Roblin are slightly lower, we can reallocate the 1 staff member down from Roblin down to Self-Red, but we're still, if we want to put those 2 vehicles per waste stream, we still lack the 1 staff member to make it happen. So, my recommendation would change if we don't have the 5th staff member. My recommendation would be to lower the 6 car maximum.
Okay, Councillor McCormack.
I'd just like to throw in at the same time that I don't believe that members of council should be directing traffic. And in conversations that I had with some of you, I recommended that we have a staff member with a proper traffic vest on be at the entrance to direct the 1 or 2 vehicles that are coming in at a time. So that needs to be taken into consideration with this recommendation.
Councillor Richardson, and then I'll come to you, Councillor Johnson.
Okay.
Thank you, Your Worship. I'm not really sure where I'm going to start, but I'm just going to let you know I was there for both days. It was night and day compared to the first day and the second day. There was vehicles on the second day lined up pretty near as far as the eye could see. I have to admit that the vast majority of our citizens were very patient, probably far more patient than I would have been. I don't think I'd have sat in that line 4 hours. We've always got to keep in mind social distancing with respect to everything we do right now. Everyone that went into that dump on both days respected that. We've heard from Dr. Moore, who's given us a very glowing report and suggested that if the influence of people coming from outside wasn't there. Our community is in very good shape. Everyone that was at that dump were local folks that have abided by the rules, that have abided by the social distancing, and that have been home for 5 to 6 weeks. And by the amount of trash and brush and everything that were in their trailers and trucks, it was very evident that they've been home for 5 to 6 weeks. I thought it was very important that they be given the opportunity to get rid of this stuff. There's people I talked to that had trash or brush in their vehicle for a number of weeks, which is started to decay. It was very important that we didn't suggest to people that have been in line for 3 hours that we were going to pull the gate shut and tell them they couldn't go in. I thought that would have been an insult to our community, would have been an insult to our people. In any event, I believe that the recommendation that's here should resolve the problem at the dump. I'm hoping. They were pushing through approximately 10 to 12 vehicles an hour with 2 vehicles in there. So with 6 in there, we should be pushing probably 25 to 30 per hour. It should relieve the problem. I would really like to put a shout out to our waste management people for enduring an extremely difficult day last weekend. They performed like princes. Nobody got upset. Nobody got mad. And I got to tell you, they had far more patience than I would have had with some people. But they performed admirably. And I just want to give a shout out to them because it sounds like a very simple thing to do, to run the dump. I can tell you that after experiencing it for 2 weekends in a row, it probably wasn't. That's all I got to say on that. Thanks.
Any further comments? Do I even have a motion? Oh, sorry, Councillor Johnson, I'm sorry.
That's all right. I just wanted to say that I was out at the Roblin dump for both of the last weeks, and I want to commend staff for the fabulous job that they did in managing both challenging work situations and dealing with customers who were, for the most part, very kind and courteous and understanding. Occasionally, somebody got a little bit hot under the collar, and they dealt with that very professionally. And I'm glad that we were there to be able to back them up and say, this is not their choice. This is what council has decreed. And we're all following these rules so that we can get back to regular life as soon as possible. They have an added challenge in that the waste bins are sometimes not emptied as quickly as they would like. And for the next week, especially when we have a higher volume of traffic coming. And I would also say that the first week in particular, almost half the vehicles that came in with yard waste. And if they brought the yard waste there, this alleviates the problem that we're going to have on May the 4th when people start picking it up curbside, or when our staff starts picking it up curbside. There was just, with the early spring, there was more yard waste than people knew what to do with. I do have a recommendation from the staff, which is not in here, and I don't know whether we can add it now or whether we should add it later. There is, just like when we first offered bag tags at no charge, there were people who abused the system. Not very many, but a few. It doesn't take a lot to overload our capacity. And this was why the staff in Roblin were concerned about the tippage. They recognize how much it costs to tip the bins. And when you have a lot of people taking advantage of a very low flat rate, the mattresses, the dressers, the lazy boy chairs that were coming in were a bit of a shock. And I did also hear about the boats that ended up at the Selfred facility. They have recommended, can we look at 2 flat rates, a $10 flat rate for small bulky items and a $20 flat rate once you start to include furniture and mattresses. And I would like council's feedback on that, please.
And maybe just a suggestion there, Councillor Johnson, is what we could do is staff recommendation has included a review and more reports coming back to us. And I'm sure somebody on staff has written that down. And if we can include that as part of their review, may not be for instant.
That's okay. Oh, pardon me. Sorry, didn't mean to cut you off, Mayor. If that waits till the next one, that's all right as well.
Perfect, thank you. Any further comments or questions? Susan, oh, sorry, Deputy Mayor Kaiser?
I just wanted to ask for clarification purposes, and this is probably for Manager Paul Dauber. If we're adding extra staff to facilitate the dump operations with the idea of COVID protocols, is that extra cost eligible for tracking under our COVID financials? And therefore it would hopefully be completely taken off of the taxpayer locally anyway.
This one is such a gray area. I've put in applications previously for ice storm situations. Excuse me, based on the situation, based on the recommendations for the province as far as the emergency, they don't really get into specifics as far as dumps or waste transfer stations. There's a possibility it could go either way, and I would be taking a guess, but my guess would be that this was a council decision and it wasn't part of the Ontario emergency. So my guess would be that no, we probably wouldn't. This would be borne at the municipality.
But we could submit it. And
Absolutely, Madam Mayor, we could submit it and try to claim it back.
any further comments or questions? And I don't even know whether I have a motion yet. Councillor Norrie, did you wish to speak? Yes, go ahead.
Thank you, Your Worship. Just briefly, I don't want to belabor things. I like what staff's come up with. Just one thing that confuses me, the first week, there was never 10 vehicles in there. We let no more than 6 and 8 in there. I don't know where that number 10 came from, but I'm not going to argue it.
Okay.
I want to say kudos to staff down there. Those 3 or 4 gentlemen truly are ambassadors for this town, with everybody keeping things calm, very safe, and they should be entrusted to make the decision how it should flow down there. That's all I'm going to say. That staff are just awesome. Thank you.
Any further comments or questions? I think this has been tough, and I'm sure that people that are watching are thinking, why are they spending so much time talking about a landfill? These landfills are assets of ours that we need to look after. We can be highly fined. We do have things that we have to meet. I think that we've always been pretty good people to look after them. And we don't want to get anyone in trouble. I agree, Councillor Norrie, to a point. I love what the staff does down there, but when it comes to the highly technical licensing part of it, even though they're very wise, there are some things that have to be decided by staff, or by senior staff, the ones that are signing for the licenses, which part of that is mine. But they were our saviors both times. Couldn't have been better. But something, council deserves a lot of credit on this too. Deputy Mayor Kaiser can say that he was on his tractor, but he still had a lot to do with making this a success. It is different times. I mean, we had people off work. We should have the cleanest yards, the cleanest basements, the cleanest everything, everywhere. And it worked. Councillor Richardson, at some points, I thought he probably should have been wearing his gun, but he was so good with people, as were staff, and Councillor McCormick and Councillor Norrie, and certainly Councillors Johnson and Pennell too. The work that you did was wonderful. I think that we need to do this, and hopefully things will calm down. I just think it's an anomaly, and I pray that it never ever happens to us again. I think we've tried our best to make people happy. That isn't always possible, but this is a solution that looks like it should work for everyone. Do I have a motion to go with staff recommendation? Deputy Mayor Kaiser, seconded by Councillor McCormack. Any further comments or questions? Okay, roll call then, please. Councillor McCormack.
Ward 1, yes.
Ward 2, yes.
After listening to you, Mayor, yes. Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Okay. Mark that one off. We're getting there. 6.9, Financial Services 2020 Financial Update. Our GM of Finance, please. I know you have the report before you, but does anyone have, Paul, do you wish to speak to it first, or do you wish council to ask you the questions first?
I believe this, thank you, Madam Mayor. This is a continuation on of a report that came up as financial aid previously, and then an update at the last council meeting. This is a continuation on to keep council informed and to let council know that he'll be coming back with something quite a bit more detailed at the end of May when more information is available. I think at this time I would just be available for questions.
Okay. Any questions of our financial GM? No? If not, you have a recommendation. You have, I need a motion to receive. Councillor Norrie. Councillor Richardson. No further comments or questions. I'll call the question, please.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Word 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. And Paul, thank you. I know that you're watching each and every penny. I also know that you're being questioned by council and staff daily, and you're doing a great job tracking these things. Boat launch is 6.10 infrastructure services. Boat launch to be provided under separate cover, which you have as council received the information that has been gathered about the boat launches. You also have a summary of action items from the Greater Napanee Municipal Emergency Control Group held April the 30th, in which this was discussed extensively. So I guess certainly there is no recommendation there. Well, there is a recommendation, but it's not such a recommendation. Who would like to open this conversation? Deputy Mayor Kaiser.
Fool as I might be, we have from our emergency management group and our safety officer a recommendation to keep them closed. And I think, Dr. Moore, if unless somebody wants to disagree with me, my interpretation of his words were a strong caution, just short of a formal recommendation to keep them closed. We are at risk of movement, and this is an area that is known for fishing. We have access to the lake through the Bay of Quinte and Hay Bay. If we open it up for fishing, I can clearly see both sides of the argument. I can clearly see and defend and accept either side of it. I'm not sitting on the fence. I am leaning towards keeping them closed because that's how we got here to having virtually no deaths and very, very, very few cases at all in our community by keeping our activities and our movements to an absolute minimum. And that's the way we're going to keep it that way. Every link in the chain, every match head in the line, whatever picture you want to draw for yourself, everything we do or choose not to do will affect the spread of this COVID around and around and around again. And as it came up on our county meeting earlier, there is no immunity. You can't get it once and never get it again. There is proof now that people can get it twice and they can be transmitters twice or more. This is one more thing. We're asking for patience. In another 3 weeks, other parts of the province will start to open up for fishing and people will be able to fish closer to home if that's the case. We're still recommending strongly against movement to cottages. We heard that earlier. I don't see how we can be the only municipality in the region in a larger region, East Central Ontario, if we're the only municipality with boat launches open, man, we're just rolling out a red carpet for COVID-19. That's my opinion. And I want to just go on to say, we have some good people that have done very well. And it's not that fishermen by the nature are irresponsible. But if I were to leave my house and go less than a kilometer to the community boat launch on Bayview Drive, I might have to get gas at the Canadian Tire in town. And I'm drawing the Canadian Tire because it's so close to the 401, and the gas pump that I might choose to use might have just been used by some traveler through our community coming from Montreal going to Toronto or vice versa, or who knows where. That could be the vector. That could be the moment. And it's not worth the risk. I recognize that for mental health, for everybody's enjoyment, everybody's just satisfaction of life, we need to move forward. I also know that the fishing is being permitted to open by the province for pickerel, and people will find their way to the water. They always have, and they always will. There are a number of boat launches that are not municipal that will be open. But I just think if municipally we make a statement that we're opening our boat launches, that we're rolling out that red carpet, and I do not want to be responsible for that. That's what I have.
Councillor Richardson? Yeah, Terry, you need to unmute yourself, please.
Sorry, Your Worship. I appreciate everything that the Deputy Mayor says, because I think all of us are probably going to be somewhat agreeable in a lot of things that we're going to say. As I listened, and I specifically asked Dr. Moore, he said that boat launches in and of themselves aren't at risk. His biggest concern is the influx of a possibility of people coming in from outside the area. Our friends to the south, the United States of America, can't come fishing. We have our campgrounds, for all intents and purposes, shut down. So that should reduce any persons coming from outside the area. There's no place to stay. So unless they're going to stay in a motel, our restaurants aren't open. So the only place they can eat is for takeout. I guess the problem I have with limiting or trying to limit people from coming from outside is we've got this thing called the 401 that runs through here each and every day with hundreds of thousands of vehicles on the 401. It's pretty safe to say that persons coming from Toronto to Ottawa to Montreal are stopping in our community and touching the gas station pumps and touching the keypads at the restaurants. That's happening each and every day. And you know, you could use the argument, well, why don't we shut the 401 down? That should keep the people from coming here, right? So, which obviously is ludicrous, and we can't do that. So his biggest concern was people coming from outside. We don't have a big population of people coming from outside. I say everybody's getting gas, everybody's going to the restaurants. We do have a number of places that people can put their boats in, and one of them is Huff's Lane. It's not a regular boat launch. It's a place that the end of the road dumps into the Bay of Quinte. And yes, you can't park on Huff's Lane, but there's nothing to say that you can't put your boat in the water there, park your boat and trailer on County Road 9, which all of a sudden becomes a traffic hazard, which is going to cause all kinds of other problems. And of course, there's countless numbers of boat ramps that are personally owned that people are going to get onto the Bay of Quinte. I know we have already started to see persons trespassing and persons sliding boats into the Napanee River like illegally. And I know because some of these things have been reported to the OPP. So we already know that it's happening. I guess my concern is that because fishermen aren't bad people, they're good people. And, you know, they're very conscientious. And when they want to go fishing, they put their boat in the water, they get in their boat and they go fishing. And when they come back, hopefully they've got a limit of pickerel. They want to get home and eat them. So they're not going to stand around the boat launches. They're not going to socialize there. They're going to get in and they're going to get out. If we don't open our boat launches, the risk we're running is that the places like Huff's Lane are going to get inundated with other people, with boats, with trailers. County Road 9 is going to get loaded up, and I just don't want to see that. You know, that I know that there is risk, and I pay heed to what Dr. Moore said. I understand what he's saying, and I have a lot of, as I said earlier, I have a lot of faith and I have a lot of respect for the man, because the man is common sense, science together, which sometimes we don't always see. But as I refer back to it, his biggest concern, it's not the boat launches, it's the influx of people coming from out of town. And just by the nature of the shutdowns, I mean, the province of Ontario has encouraged people to go fishing. They sell fishing licenses, they sell hunting licenses. There's boat launches. The Cataract Conservation Authority, I know in our report suggests the one on Hay Bay is closed, but all the inland boat launches are open, which again causes more confusion, because why are these ones closed and these ones open, sort of thing. So I personally don't believe that the risk is that great that we can't open them. Everyone has to do what they have to do as far as social distancing. Everybody has to do what they have to do with respect to not getting in groups. Most of our boat launches aren't large. They're not like boat launches in marinas. They're small boat launches, so people can get their boats in and away they go. And obviously parking is going to become a problem. We haven't got docks in, so people aren't going to be hanging around the docks. They're going to get their boats in. They're going to get them away from the shoreline. They're going to go fishing. Fishing and boating is a fantastic activity that can be done maintaining social distancing. Families can get out. We got to remember our kids have been locked up for a long period of time, and there's mums and pops out there that just want to take their kids out in the boat, and we're somewhat restricting that ability. So I personally would be supportive of opening boat launches, but I do have to admit that listening to Dr. Moore made me think about it as well. So.
Thank you. Who else would like to speak to this? Councillor McCormack.
So just comparing what happened at the landfill site the first week and then the second week, huge adjustment from going to several vehicles in down to two. And they've approved reopening the conservation trails and community gardens. Is there not a way to consider possibly a test on the weekend to allow maximum 2 people per boat? Give somebody a chance to put their small aluminum boat with their 9 horsepower in the water, go do their day of fishing, come back, as Councillor Richardson said, they go home with their fish. I just would like to see at least a trial. And if we found that it was abused in any way, we could shut it down. This is the weekend. This is the one that everybody's waiting for. I'm not going out, but I know a lot of people are chomping at the bit to get out there. So taking into consideration what Dr. Moore said, I understand that. I also have to admit that where I live, I'd say at least 40% of the people are cottagers who have continuously gone back and forth to the GTA, and they come and spend 3-4 days, and then they go back to the GTA, and then they're back again, and they think they're safer where we are. But there's been no policing of that activity. People are still doing that, and we're still maintaining a no infection. So that's my 2 cents. I would like to see it open. But I take into account what Dr. Moore said as well. So it's a bit of a toss up.
Councillor Canal.
Thank you, Worship. I just want to go back to this report that we were just handed this afternoon. And it shows the surrounding municipalities that have the boat ramps. We start off with Quinte West, and their 3 are closed indefinitely. Belleville's 4 are closed. Desverano's closed until the provincial order is lifted. Prince Edward County has 11. They're closed until May 12th. Loyalist has 2, they're closed. Kingston has, they're only suggesting the one at Collins Bay is closed. Napanese has 4 or 5, I think there's 5 you count, and they're closed. I just believe that if we were to open up, that it would indeed direct the traffic, because of all these places that we just talked here are all the same fishing grounds. So if we open up our municipal boat ramps, I would say that they would probably all come down, use them, put their trailers in correctly, no damage there, safe parking. I think that that's what we would see, and that's all I have to say about that.
Yeah, Councillor Norrie.
Thank you, Your Worship. Originally, yes, I was for opening for mental health. There's been a lot of studies, reports from last Saturday, actually, from the federal government doctors about fishing. But I have to say, Dr. Moore made me think about the transferring of people, and that's the scary part for this area. I'm leery of the GTA people. I have friends in Hamilton that are dying to come out here to fish, and we can't do that right now. So I'm going to have to. Pardon?
Or choice of words.
Okay. Sorry. But I'm leaning towards saying leave them closed for now for maybe a couple more weeks, 3 weeks, and see how things are going until, because of this fear of the people coming in from out of town, if we can put a wall around and just be Napanee only, then that would be fine. But I'm leery of that because we're doing so well with our health and safety of everybody. So, and I'm not a fisher person. So, you know, this weekend doesn't mean anything to me, but I'm sure for a lot of people it does. But that's my 2 cents.
Councillor Johnson, did you wish to speak to this?
Thank you. I think I'm the only one on council who doesn't have a boat. But I will say that taking everyone else's comments into mind, and I agree with Max Kaiser. I can see all the plus, or Deputy Mayor Kaiser, I can see all the pluses on both sides of the argument. I will also say that as my husband and I practice social distancing, it's like date night again, and we get in the car and we drive for 3 or 4 hours throughout the community. There are a lot of small venues, don't ask me where they are because I couldn't tell you, where you can see people have put boats into the water, where there are small boat launches that are accessible, that are probably just known to the locals. If it were possible to open our boat launches just to local people, I would be all over that 100%. There is no way to police this. And I feel badly for the people who are craving some outdoor time and getting out and away from 4 walls. But I think maybe, I don't know, can we put a timeline on this? Can we say, this is going to be no for now, but in 2 weeks, we're going to open the boat launches, dependent upon the fact that the situation does not get worse. If we stay the course or if we get better, I feel like if people had a target in their minds that they could say, okay, I only have to sit still for 2 more weeks, then they can cope with it and they're more willing to accept the change. Do we have that opportunity available to us?
It may be mandated to us very quickly if the province was to say that the phase 2 would be, for opening up, would be brought up faster, because phase 2 includes recreational facilities. Nobody's ever really come out and put the boat launch tab on that. But that certainly seems to be included in phase 2. Deputy Mayor, did you wish to speak again? And then I will be the final one.
Yeah, I just wanted to add to what you just said, and I don't know if it's necessarily, there's draft policies out there that are considering phasing and the different phases. And my understanding is that the first phase out of where we are would include boat ramps, or at least that's a common recommendation. So I think that if the province holds to their May 12th movement to begin phasing back into normal or a new normal, you're going to see boat launches in that first phase. I think that's a pretty common and reasonable thing. So I think that's the deadline. That's the timeline that we're looking at. And that's what Desirano has said, is when the province lifts their orders, I think we should be maybe on that same line and be consistent with our neighbors, because they are our neighbors, and the residents there and the residents here, you know, if we're all sort of working under the same sort of timelines and protocols, I think that's the best situation for everybody. And having said that, it's been said here already, if you live here, you know where you can get your boat in. And if it's not on Bayview or on the docks in town, you know somebody, or you know somewhere, and they're out there. That's all I want to say about that.
Any further comments from council on this issue? And then I'm going to entertain a motion, because I don't even think in writing that we really have a recommendation. You're going to have to kind of bear with me on this. I know I get rather long-winded, but this is something, like the deputy mayor, that I've been back and forth on for quite some time. For the past 6 weeks, almost 7, 2 teams of staff, along with myself and at municipal level, Deputy Mayor Kaiser, have sat in on mandatory, legislated, documented meetings that are all being in a declared state of emergency. These meetings take place usually 2 or 3 times a week, done virtually. There is a set agenda with all sections as set out by legislature, reporting on detail and following up on action items. Details have been worked out, most of the team reporting in from home offices, but still doing their day-to-day duties. This has been always core staff and or their alternates working in municipal buildings or facilities, even though they are closed to the public. Staff redeployment as well works on work descriptions that have kept us moving ahead, while making sure that staff and the public are working according to the rules put down by the provincial government, not by us. At the end of every meeting, action items are taken away and being reviewed at the next meeting so things don't fall through the cracks. Many times between one meeting and the next, changes come down from either the federal or the provincial that must be dealt with. Planning, logistics, communication, financial, safety, and emergency and enforcement agencies are also involved. At least once a week, councils on both levels are sent reports from the meetings, week's meetings, and I at least once a week try to speak to all of the municipal councilors to bring them reports from the meetings, as well as gather information to take back to the EOCs. Honestly, this is leading up to something, so bear with me. Through all of this, the messaging for beating or at least flattening this pandemic has been extremely straight from the medical officers of health at all levels. Stay at home, isolate if necessary, hand washing and surface cleaning, and physically distance yourself. No gatherings of over 5 people, no park facilities, recreational facilities, or congregating opportunities. Stay well, stay at home. Check out any website, whether it's provincial, federal, municipal, or health unit. Message, stay at home, stay well. These websites are starting to change slightly into looking at opening up opportunities for business and even more chances for people to enjoy things that they haven't been able to for a while. But that part is here, but the planning part is here, but the actual throwing open of the doors is a couple of weeks away. Exact words from all levels. Businesses, families, friends, kids have all made sacrifices here in Lennox and Addington and Greater Napanee. Touch wood, we have done so well. I battled with the discussion of opening boat launches. I dearly wish that we could just open them up for our own residents who have fought this battle and deserve to be rewarded. But so do those that want to go to their campgrounds. So do those that want to visit their children and grandchildren and parents who may be in a hospital or long-term care. My fear is that it's not our own folks who will adhere to the rules. It's the fear of so many folks from outside the area congregating here, as we will be the only launches open. Desirano, Hastings, City of Belleville, City of Kingston, all of Prince Edward County, All decisions made by their EOCs are remaining closed to protect the influx of those from outside. We have communities on both sides of us that have outbreaks and hotspots. My fear is that they could spark another outbreak here. When council worked to make the decision on landfills, much of what was based on, much of the thought was based on what other municipalities around us were doing. In this case, much of the thought seems to be to go in the opposite direction. So I can't support opening the launches for two reasons. Some is fear of losing ground to all that so many have worked toward. But more than that, we have worked for almost 7 weeks as a unit following stay at home, stay well. I feel it would be wrong and in fact hypocritical to work under one rule and one message for all this time and then go in the opposite direction of what we're being told to and the direction that has worked so hard. My opposition is not meant to deprive, but it is meant to do what I feel is best for everyone. I feel that it is much more important to be looking at how we open our business and industry to benefit everyone and to start moving our municipality forward rather than taking the chance for 1 or 2 weekends to let some people do what's important to them. I thank you for your patience. I will entertain, unless there are any other comments, I will entertain a motion as to which way council wants to go on this. And I'm not sure, just for the benefit of the public, not so much yours. I guess maybe somebody did read the information about everybody around us that was closed. And I know there's always been some question about Stone Mills and others having theirs open. Stone Mills has reported that their boat launches are owned by the Ministry of Natural Resources and Forests and Water Access on open road allowances, and they have no control over it. So they really don't have boat launches. Who would like to make a recommendation here so that we can decide and see which way this is going to go? I've got 2 hands up here at once. So actually, Councillor Pennell beat you there, Councillor Richardson. Councillor Pennell?
I was going to say, Madam Mayor, I'm not very popular tonight, I know. So either I take the fall, but if Mr. Richardson would like to do it, then that's fine.
So you're deferring or referring to Councillor Richardson? Councillor Richardson.
Thank you, Worship. It's really quite simple. Are we going to open them or not? So I'll tell you what, I will make the motion that we open them. And I think we can just make a vote as we're going to open them or not.
No, that's the simplest way. Do I have a seconder for that motion? Councillor Pennell is the seconder. Any further comments or questions? The statement is moved by Councillor Richardson, seconded by Councillor Pennell, that we allow the boat ramps to open. I guess it would be as soon as they can get them open. Councillor McCormack.
We didn't hear you, John. You turned your mic off.
Sorry, yeah.
Sorry, and then you got, then it was, so yes, you said? Yes to open, sorry.
Yes to open.
Yeah. Councillor Richardson.
Yes.
Councillor Pennell.
No.
Councillor Norrie.
No.
Councillor Johnson.
No, not yet. Sorry.
Deputy Mayor Kaiser.
Deputy Mayor Kaiser says no.
Mayor Isbester says no. The motion is lost. The boat launches will not open. The vote was 5 noes and 2 yeses. Thanks, Council. I know that was certainly not one of the easier things we've had to do during this pandemic. Oh. So I am up to Municipal Emergency Control Group update, part of which you've already had, but I would like to report to council on a county council update for this weekend. Sorry, that we had a meeting right before this. And this is some good news and will give us some better timelines. KFL&A and the partners within it, Kingston, Frontenac, Lennox, and Addington, have been meeting to see just when we can start our plans to open and how we would handle them. And Mayor Patterson has sort of led the way with wanting to make sure that we contact the province to say, we don't want a cookie cutter approach to this. Sorry, I'm just trying to open my email to myself. County Council had a special session of council this afternoon regarding a letter that the members of KFL&A wanted to send forward to the province before decisions are made fully about lifting restrictions. And of course, those meetings are going on all weekend. All next week. The three partners, City of Kingston, County of Frontenac, and the County of Lennox and Addington, wish to submit a request that there be a regionalized approach to the lifting of the restrictions based on the needs and the capacity of the areas. The warden was authorized by resolution to co-sign the letter to the province. The plans for lifting and recovery were reviewed, and an input from all lower tiers are being gathered. The discussion included the vast differences between even our county lower tiers, the influence of people visiting our areas due to 401, number 7, and 41, cutting through our communities, the influence of close neighboring communities traveling in for goods and services and even employment, that the lifting of the restrictions would be at a controlled pace with health and safety always being looked at. I just wanted to bring you up to date on that because I think it's very important that we as lower and upper tiers have some say, just like we have had today, in what needs to go on in our community. So there'll be lots of input coming. Anything further that council on my report or anything that you'd like to say? We do have some bylaws, and then we'll get into statements by members.
Mayor Isbester,
I'm sorry, yes.
could we just have a resolution to accept your report, please?
Oh, okay. I need a resolution to the Deputy Mayor Kaiser, seconded by Councillor Norrie. All in favor of that?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Thank you, Susan, for catching me on that. Bylaws. Bylaw number 2020-0027 to establish tax rates and to provide for the collection of taxes for the year 2020. First, second, and third reading. Councillor McCormack, Deputy Mayor Kaiser. So any comments or questions? Okay, roll call, please.
Ward 1, yes.
Mayor, can I have a recorded vote on this, please?
They're all recorded right now. Yeah.
Sorry.
That's okay. No, we're doing it this way, Councillor Johnson, all our because many people aren't seeing this and how you're voting. So that's why we're doing it this way. Councillor Pennell.
Oh. Ward 2, yes, sorry.
Sorry. Yeah, no, I got you, Terry. Yeah.
Oh, okay.
Councillor Pennell.
Ward 3, no.
Councillor Norrie.
Ward 4, no.
Councillor Johnson.
Ward 5, no.
Deputy Mayor Kaiser.
Deputy Mayor Kaiser, yes.
Mayor Isbester, yes. It is carried 4-3. Bylaw 2020-0028 to amend zoning bylaw number 02-22 as amended, and that's regarding 449 Milligan Lane. First, second, and third reading. Moved by Councillor Richardson, seconded by Deputy Mayor Kaiser. All in favor of that, please?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Bylaw number 2020-0029, official plan amendment. Number 39, Richmond Park Drive North Development. First, second, and third. Moved by now, seconded by Councillor Norrie. Councillor McCormack.
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Statements by members. Deputy Mayor Kaiser.
Thank you, Your Worship. I have three quick little things I want to, well, maybe not that quick. I'll try to be quick. First of all, Dr. Karen Moore mentioned 211 Ontario. Great little resource online or by phone. You can simply call 211. It's a non-emergency helpline, and it covers all kinds of things. And if you have questions about mental health and addictions, if you have questions about employment and training, this is a provincial service, and I didn't know about it until he mentioned it. So I just want to make sure that I drew further attention to it. Secondly, very seriously, a strong shout out to Your Worship, to our senior staff and all members of the emergency management group that have been dealing with a lot of stuff in an abnormal situation from home, from modified offices, everybody working extremely hard. And I include all of council, but most specifically, Your Worship, I know how many hours a day. I don't know when you sleep, because I can call you at 6 in the morning or 11 at night and you answer your phone and you've been awake for a while. So maybe you nap, I don't know. But I know you're working hard and you're absolutely passionate about getting through this and doing our best. And I know our senior staff and the emergency management group are 100% invested in doing this right, doing it by the book, doing it to the letter, following every guideline. And I can't say enough thanks to everybody involved. And then my third item, I just wanted to speak for a moment about the Richmond Park Drive development, because from my perspective as a farmer, I see that going down on farmland. And at first it was a little unpalatable to me, but I have to say that our official plan designated that area as fringe land. It is not prime farmland, and it hasn't been, it was never given that protection. Because it is in immediate proximity and within, you couldn't draw a circle from the center of town and not include that area. It's obviously therefore better to continue development within a vision that doesn't overly encourage sprawl in other directions outside the community. It's an easily serviced area, but it's also in immediate proximity to the school, to commercial districts, and it just fits. And while it is going down on land that was producing food, ultimately every house that's built goes down on land that at some time was producing food. And I'd rather see it focused and visioned and developed with some sort of comprehensive plan, which it is. And again, somebody along the way had the vision to see that, do that, and focus it. And that's why we have things like prime land designations. And so it may not be in keeping with my usual absolute definition or defense of farmland, but in this case, urban expansion has to happen. It might as well happen close to the urban center and not somewhere out in the rural countryside. So I just wanted to sort of say that out there, because I know I sometimes get a sort of evangelistic about these things. And here I seem to be just bowing to it. And I really wasn't. I was thinking about it, but it's just one of those things. I mean, Toronto has the best farmland in the country, all under asphalt and concrete. And that's why the people are there. And that's the reality of it. We got to protect what's left. But in this case, the town has to grow and might as well grow close to center. That's all I want to say about that. And I am done. Thank you.
Thank you, Deputy Mayor. Councillor Pennell.
Thank you, Worship. I just want to take this time and thank all of the staff and all of us council who worked on the sale of Heritage Park. It was nice to see that did finally close. Like most real estate transactions and sales of that nature, the time between the acceptance of the offer and the time the due diligence is done and then final closing, more times than enough is very long. And with commercial developments and commercial sales, a year or 2 years for it to close is not unforeseen. And after sitting dormant for so long, it's going to be nice to see some development go up there. I had this little thing sent to me, and I kind of like it because and John, you'd appreciate this being a pilot. I'd just like to remind people about COVID-19. Just because you jump out of a plane with a parachute on, and once you open that parachute, it slows you down, slows your fall down to the ground. In no way should this be an indicator for it to be safe for you to remove that parachute. We may be feeling good, the weather is getting better, but this is no way an indicator that we should let our guard down and go back to normal. So.
Thank you. Okay. Any further comments? Oh, sorry, Councillor Norrie.
Thank you, Your Worship. I don't want to keep bringing up old stuff. I made a mistake last time in suggesting council listen in on to the emergency group because that would constitute us having minutes in that. But I've been reading through a lot, and I know you call us as best you can, and I appreciate that, but we're still not getting the full amount of information. Is there any way, if there's just you or the deputies meeting, that we could have two counselors just to listen, not to participate, so we are getting true information? I mean, daily, our premier gives a beautiful news. He talks at 1 o'clock every day. So we're getting full information, not what you hear in the news. And I'm just hoping we could start listening in just so we have a better understanding instead of these snippets that we get. And I don't know, I just feel like we're being left out. Maybe it's just me, but, and I know senior management doesn't want to mean that way, but that's how it's heading. And I would like you say, the mayor and or deputy and two councillors. I'm not making a motion, it's just an idea. And that's my thoughts. And thanks for all the hard work.
Thank you. Deputy Mayor Kaiser, did you want to say something? Oh, sorry.
I wanted you to say it.
Oh, you want me to speak to what Councillor Norrie has said? If that was the way, Councillor Norrie, that our bylaw had set up, now maybe after this whole emergency situation is over, we can change it. But right now, what we're doing is going to what the procedure and the bylaw that we all put in place. I'm sorry that you feel that we're not keeping you up to date enough. I don't know what more we can do. There is a process, and it's the same at both county and here. I guess what my suggestion would be is if you wish to change it and how we handle the EOCs, then it might be better to bring that forward after this one is over. That's the easiest answer that I can give you. And we all went through the training, and we did actually vote for, and I think I can remember who the movers and seconders were to accept it. And I've got to say that even then, it's pretty vague because you never think we're going to go through this. You know that I'm available to answer any questions. I always, when I phone, try to bring any information back up. I'm hoping that you're not thinking that we're hiding a whole lot of stuff, because that's fairly serious to say out loud. So I'm not going to challenge you on it, but I'd be happy to discuss it with you at any time. Okay. Yeah, Councillor Richardson.
Just briefly, Your Worship, for some of us that used to drive over the train tracks on Center Street instead of under them, when we got over top the train tracks, there was nothing but cornfields and wheat fields. So to the deputy's point. Secondly, I'd just like to do a shout out to the community and remind the community that we're getting there. We're making the curve. We're going to get there. We've heard nothing but good things tonight with respect to where we sit, and just the talk of reopening things should put a smile on everybody's face. So we are getting there. Our community is probably the best community in this province, so just stick with it. Stick with us. We'll get there, and hopefully this will all just be a bad memory at some point. Thank you.
Certainly well said. It has been very tough. Councillor Johnson, did you have your hand up to say something? Go ahead, please.
I did. Thank you, Mayor. Ditto to what everyone else has said about recognizing and thanking the hard work of staff and the fellow councillors. And I would just like to add on to that, I appreciate that we may not always agree on topics, but our discussions are open, honest, and we're all looking out for the best of the community from our different points of view, and we walk away and our community is stronger for it. So thank you all.
Okay, thank you very much. And thanks to everybody for everything we're doing. It's kept everybody busy. The only thing that I'd like to give up is I really want a haircut, and I see several other people out there that could go the same way. It has been a tough go. I know you're all facing all kinds of people that come forward to you, but staff at both levels have worked extremely hard. It's easy for me to go ahead and do my work when I've got good people working with me. Never ever did any of us think that we would have signed up for something like this, but we're there. Everybody's doing a good job, so we just have to keep going, including the people that we represent. There are going to be some unhappy people no matter what we do, but I think that we've all got the interest of everyone at the utmost when we're trying to make decisions. So thank you very much. And if there are no further statements by members, we have a bylaw to confirm the proceedings of Council of the Corporation of the Town of Greater Napanee at a special session held April the 30th, 2020 for second and third reading. Moved by Councillor McCormack, seconded by Deputy Mayor Kaiser. All in favor?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. Carried unanimously. Motion for adjournment. Don't everybody throw their hands up at once. Councillor Pennell. Seconder? Councillor Richardson. All in favor of that?
Ward 1, yes.
Ward 2, yes.
Ward 3, yes.
Ward 4, yes.
Ward 5, yes.
Deputy Mayor, yes.
Mayor, yes. I didn't think that would be a tie vote on that one. That one, some reason. Thank you very much, and thank you very much to the people that tuned in. You know that each and every of your councillors are available for questions, just as for council staff available to us, as am I. Thanks very much for all your hard work. Stay safe and have a nice evening. Thanks. Bye-bye.